All right, let's jump right into this explainer and demystify a really intense type of pelvic pain that so many people experience, yet completely struggle to understand. Now, deep endometriosis is definitely a complex topic, but today we're going to zero in on the exact mechanics of why it hurts so much. We're going to literally visualize what's going on inside the body. So we're kicking things off with the most important question for anyone dealing with this. Why exactly is the pain so incredibly intense? If you, or maybe someone you know, has battled this, you know for a fact it is not just some mild ache, it's severe. It can be completely debilitating. To figure out why it hurts so bad, we really need to look closely at the environment where all this is happening. Section 1. Understanding the geography. Where exactly is the pouch of Douglas? Let's clearly define our focus for today. We're looking at a condition where severe adhesions form in a really specific, confined space within the pelvic cavity. When we talk about deep endometriosis in the pouch of Douglas, we're basically looking at tissues becoming glued, literally stuck together in this tight, restricted area. And these glued patches, those are what we call adhesions. To really picture the geography here, imagine your two major pelvic organs, the uterus and the rectum, sitting right next to each other. The pouch of Douglas is that exact little pocket of space resting directly between them. It's an absolutely critical area, mainly because of the total chaos that unfolds when adhesions decide to invade this specific gap. Section 2. The catalyst. How adhesions change the environment. Okay, let's break down this mechanical chain reaction, because it's essentially physics happening right inside the pelvis. First, an adhesion forms between the uterus and the rectum, sticking things together that absolutely should not be stuck. Then, step 2, one of those organs naturally tries to move. Step 3, thanks to that superglue-like adhesion, the affected tissue is forced to stretch and pull. And finally, step 4, this violent pulling results in severe pain. It's a surprisingly simple chain reaction, but man, it is completely devastating for the patient. Section 3. The mechanics of pain. Defecation and intercourse. The source material zeroes in on two primary, highly representative symptoms caused by these specific anatomical adhesions. The first one is severe pain during defecation, and the second is pain during intercourse, which you might also know as dyspareunia. And you guessed it, both of these specific symptoms trace right back to that exact same mechanical chain reaction we just talked about. So, looking closer at the first symptom, during defecation, the rectum has to physically move and contract, right? It's a completely normal, necessary bodily process. Your rectum is actually supposed to be super flexible and dynamic within that pelvic cavity. But here is the crucial point. Because the rectum is stuck to the surrounding tissue by those deep endometriotic adhesions, it literally can't move freely. So its natural, necessary movement ends up violently pulling on those trapped, glued tissues. The rectum is just trying to do its normal job, but the adhesions have totally locked it in place. That creates this sharp, severe pulling force that translates instantly into intense pain. Now, a very similar mechanical action happens during intercourse. When there's physical stimulation in the vagina, it actually causes the uterus itself to physically shift around inside the pelvic cavity. And under normal, healthy circumstances, this internal shifting is totally fine because the organs have plenty of room to just glide freely against one another. But again, if the uterus is adhered right there in the pouch of Douglas, that natural movement suddenly becomes a massive problem. The shifting uterus forcefully pulls against those trapped, scarred tissues. It's literally dragging against the adhesions connected to the rectum and everything around it, which triggers intense, sharp pain. The underlying mechanism is exactly the same as with defecation. Movement against a restriction equals severe pain. Section 4. Validating the experience, recognizing the signs. Patients consistently report this very specific description, a strong, pulling-like sensation. And that perfectly aligns with the physical mechanics we just went over. This is not just a dull ache or your generic everyday cramp. It literally feels like something is being stretched or dragged inside. Because, well, mechanically speaking, that is exactly what's happening to those adhered tissues. You know, while a lot of gynecological conditions can cause pelvic pain, experiencing this highly distinct pulling sensation is a massive indicator of deep endometriosis in the pouch of Douglas. If someone describes their pain this way, especially during those specific activities we talked about, It is a giant red flag pointing straight to severe adhesions between the uterus and the rectum. So I want to leave you with this thought. If you or maybe someone you love recognize this distinct mechanical pulling sensation, could understanding these hidden internal mechanics be the exact clue needed to finally uncover the root cause? Listening to how the pain actually feels, that specific, undeniable pull might just be the key to unlocking the right diagnosis and finally getting some answers.